Well, by now, I'm sure everyone's heard about my newfound allergies, right?
I'm sure everyone has by now.
Yes, we've talked about it since I moved here. I've really been struggling, and I feel for people who've lived their entire lives dealing with this.
Yeah, but you didn't have any problems until the last month or so.
Here. Right.
Last couple
it's
months.
been
Well,
bad.
need to finally give in and go get yourself checked out. The ironic thing is that our next guest specializes in allergies and can help find relief.
So I'm learning a lot today too. This is perfect. Welcome back, Dr. Samuel Medaris and Shannon Fairchild of ENT Consultants.
Thanks for having us.
This one is really
Morning.
excited you guys are here this morning.
Oh, I was
We're
pumped.
here, yeah.
I was really pumped, yes. So Dr. Medaris, tell us, what are allergies and what are some of the symptoms?
Allergies are sort of your body being stupid, for lack of a better term. I mean, there's things in the air that are not viruses or not bacteria, and yet your body makes an immune response to them. So it decides that the ragweed pollen or the grass pollen, which may be what got you a couple months ago, is something evil that needs to be fought, and it makes you miserable. And so our job then is to try to figure out how to block that or how to treat that or how to minimize it.
So let's go down the list here, Kelly.
I have
runny nose,
yes.
nasal congestion,
Yes.
watery eyes,
Yes.
itchy eyes, itchy
Kind of,
nose, itchy
yes.
skin.
No.
Okay, sneezing, scratchy
Yes.
throat,
Yes.
wheezing. These
Yes.
are all common allergy symptoms.
They are.
Literally have all of them but the headache.
Yeah, when you put a bunch of them together, it's hard for it to be anything but allergies. People get colds and they get some of those things, but the itchy, watery eyes, the itchy nose, the sneezing, if you're getting that, especially in certain times of year after being outside, you don't have any question of what
Yeah,
it is. You'd already
definitely.
figured
Well, there you
it
go,
out.
certain times of year. So we have these allergy seasons,
Right.
right? And
We
this
do,
is
yeah.
one of those seasons.
It is. It's kind of pretty much the growing season. Trees kind of hit early in the year, so when people that early spring, when you're first starting to see some buds on the trees and they're already miserable, you can guess that you've got a tree allergy. We don't get a lot of grasses yet. Grasses are a pretty long season, where they were kind of right through the middle of the summer. And as we hit here the end of the summer and into fall, it's mostly weeds, and so we'll say ragweed. In fact, if you look it up online, they'll give you the ragweed counts most days. Not that that's the only one that can do it, but that's kind of around here is one of our more predominant allergens this time of year.
So to me, it's looking like I'll be clear in December, and that's about it.
Well, yeah, some people with bad seasonal allergies can't wait for that first hard
Yes,
frost. Like, oh,
yeah.
thank God. Now, it doesn't get you away from some of the indoor allergens and our loving pets and some
Right.
of those things, but it helps with the seasonal for sure.
So you're going to ask him?
Yeah, what can people do at home to help with these allergies?
Well, I heard you'd already started on Claritin, and that's a good
Yes.
start. I mean, we got Claritin and Zyrtec and Allegra and some of the older ones that seem to make it.
Nasacort spray,
we got the
too.
sprays. The nasal steroid sprays are good. They're safe to use, more long term. I always tell people make sure you're pointing away from the middle of the nose when you use them. Those
what?
You want to point away from that. Don't hit the divider. Always want to bait out and off to the side.
Oh, well, I
so if
wasn't
you're,
doing that
I
right.
know there's this tendency to kind of go up and in. People feel like the nose goes this way. It's kind of back into the side. The sidewall is what you want to hit.
That's a good tip, Kelly.
Yeah.
is.
So if you're shooting it the right way, it does a lot more, and it also doesn't
Yeah.
give you nosebleeds if you're shooting it the right way. And then we do. I push people all the time to try to get brave and try a nasal rinse because
Yeah.
they're weird.
The
and they're
neti
weird.
pot, I've
Such
done
as-
it. No,
Yeah,
it
it's weird the
it
first 2 or 3
helps.
times, but dilution is a solution to pollution.
Right.
Get the
Yes.
stuff out of the nose. You can get the allergens
need
off
to
the
get
lining
one.
after an outdoor run.
Did you hear that?
And it does help.
Dilution
Is
the
the
solution
solution
to pollution.
That helps.
I like it.
Also, some natural therapy. How about local honey? I told her about that. Try
Yeah,
some
he said
local honey.
local
So we'll talk, Shannon will talk a little bit about our
Yeah.
immunotherapy. And
Yeah.
local honey is kind of your attempt at your own local
Uh-huh.
immunotherapy. So honey would, of course, have some of the normal pollens, and the bees are bringing it there. And so you're giving yourself tiny doses of what's there, trying to
Right.
build up essentially an immunity. You don't know everything that's in local honey,
Yeah,
and, the concentrations, we don't know how therapeutic it is, but it's a nice kind of start to the idea of, can I get myself retrained?
Well,
and
Mike
not be so
obviously is not a
allergic?
doctor, so I didn't really follow through on that right away.
Hey,
But
my great nana told me, huh?
hey,
Shannon, when somebody comes into the office, what do you tell them when they're describing some of these symptoms? How do you get them started?
Well, usually they see a physician first, and then the physician evaluates them and see that if they are a good candidate for allergy testing, and that's when they come and see me. And we test for 44 different antigens that are local to this area. So if it shows up that you're allergic, then there are different things that we can do to help get you to where you're not allergic as much anymore.
and that's better than those at-home Claritins and treatments like that, I assume.
Well, those help with the symptoms, but this is a long-term thing that can
Yeah.
take 1 to 3 years to help you not be as allergic as you are right now.
Well, I feel like I probably should start looking at the long term
Hey,
and get
I
into
probably, you might be in for
Yeah,
the long haul.
right.
How's the immunotherapy different, I guess, from other clinics that treat allergies that way?
Well, there are allergists who treat differently than we do. ENT tend to be a little more aggressive and find more people that are allergic at different levels. And so we can find people and relieve their symptoms to where maybe a different physician allergist says that they're not allergic, to where we can find people that are allergic.
Gotcha. So the testing is really critical, and how, so how does that work in terms of testing? Because you want to make sure you get the most accurate results so you know how to treat it.
In the office, it takes about an hour, and we start with 2 different sections of the arm, and we do intradermals and we do prick test. So there's 2 different levels that we can test you at to see if you're allergic, and if we see a negative with one level, then we can go to a different level and see if you're allergic or if you're really not allergic to those things at all.
That may be a good start for
So,
this one right
yeah,
here, right?
right.
Would that be a good place to start for her?
It's doing what you're doing is a really good start. I think people who, if they're fixed with a Claritin, well, do they want to go through 3 years of immunotherapy?
Right.
Probably not. If they say, good night, I'm having breakthrough
Yeah.
symptoms and I feel like I'm doing everything right, well, then sometimes it's helpful to know what you're allergic to.
Yeah.
Sometimes that beloved family pet, you got to know
Yeah.
how allergic you are to
Right.
them. But for the seasons, it's helpful. And I think then moving on to the next steps, you say, I'm going to live here a long time. And
I am,
this,
yeah, it might
this
be something
stinks.
to look into. Well, if you want to check it out, call ENT Consultants at 402-778-5250 or hit up omahasinus.com. Sounds like they can do a lot for you, and I got to look into this. Yeah. I'm obviously coming to you guys. So.
Well, no, but it can get very complicated. So that's why some of the doing some of the testing and the immunotherapy is a very good idea.
I mean, I had to miss a day of work. It was really
Yeah,
bad.
it'll
Like, and it
knock
made me
you
a little
down.
nauseous,
Yeah.
and it was pretty bad. So,
Yeah.
well, thank you so much for your time.
Oh,
Learned a
thanks
lot
for having
today.
us.
Yeah.
Thanks for coming. Good to see you guys.
Well, and